Welcome to my YouTube channel. It's Sister Annabelle Enes from Zambia. If you're a returning subscriber, I said thank you so much for returning to this channel. And if you're a new subscriber, I said thank you so much for subscribing to this channel. And if you're just watching, you've not yet subscribed, what are you waiting for? You're missing out a very good information that can save your life and can save your family's life. So I want you to subscribe to this channel, turn on your notification bells, like it if you're enjoying the presentation, and don't forget to drop comments. Drop comments if you have any questions for me or if you need any clarity on me. Without wasting your time, today we're going to talk about anemia. We are going to talk about anemia. We've heard people who suffered from anemia, and we've had a relative who once suffered from anemia, or they are still suffering from anemia. So today we want to look in details what happens if they say you have anemia. So we're going to define anemia. We're going to say the pathophysiology of anemia. We're going to say the classification of anemia. We're going to do the types of anemia. We're going to types of anemia. Then we are going to say the signs and symptoms, then the treatment, then the general nursing management, then we'll say the complications of anemia. So I want you to stay tuned, watch this presentation up to the end. So without wasting your time, we're going to begin. What is anemia? So the definition, anemia is a blood disorder where there is reduced hemoglobin for the age and sex of an individual, which may be due to excessive destruction of red blood cells or inadequate production of red blood cells or loss of blood. So anemia is a blood disorder where there is reduced hemoglobin for an individual, sex or age. It can be due to excessive destruction of red blood cells or inadequate production of red blood cells or blood loss, or due to blood loss. So that is the definition for anemia. So we're going to classify anemia. So anemia is classified in two segments. It can be due to the appearance of the person, due to the appearance, or it can be due to the cause. So we are going to start with the cause. So anemia, how you can identify anemia due to the cause. We have hemorrhagic anemia. Hemorrhagic anemia is due to the blood loss or excessive blood loss. So for example, in people who've just had an accident, RTA, we know when there is RTA, most of the time there is excessive loss of blood. Or patients who are in labor, like during the process of giving birth, we know mothers, they intend to lose a lot of blood. Then we have hemolytic anemia, which is due to excessive destruction of red blood cells. So we have some conditions that can lead to excessive destruction of red blood cells, such as malaria. Malaria leads to excessive destruction of red blood cells. And then we have aplastic anemia. Yes, this is due to bone marrow aplasia. Yes, it's due to bone marrow aplasia. And then we have blood forming element deficient anemia. This comes as a result of deficiency, iron deficiency, iron anemia, iron deficiency, folic acid, vitamin B12 deficiency. So when there is deficiency of vitamin B12, folic acid, or iron in the body, you can end up having anemia. Then we classify anemia due to the appearance. So we have macrocytic anemia. Macrocytic anemia, it's where in this type of anemia, the cells will appear larger than the normal. Yes, the cells will appear larger than the normal, and then it's usually seen in a folic and vitamin B12 deficiency. So your cells in this type of anemia, the cells will appear larger than the normal, and it's commonly in folic acid and vitamin B12 deficiency. Then we have microcytic anemia. It's where the cells will appear smaller than the normal, and then smaller than the normal, and they appear pale red. Yes, they will appear pale red, usually in iron deficiency anemia. Then we have monocytic monochronic anemia. Yes, monocytic monochronic anemia. It's where the cells will have the normal size and they will appear normal, and it is usually due to excessive loss of blood. So in normocytic normochronic anemia, the cells are normal, they will appear normal, they will be, if it's red in color, they will be red in color. This comes due to excessive loss of blood. So those are the classification of anemia. Then the types of anemia, they come back again. We have hemorrhagic anemia, which is sudden loss of blood due to trauma, like I said. So hemorrhagic anemia can be due to trauma, due to childbirth, due to surgery, due to chronic epistaxis. Yes, epistaxis. Then there can be schistosomiasis, which is a warm manifestation. Yes, anti-inflammatory drugs or anticoagulant medication can lead to hemorrhagic anemia. Then we have then another type of anemia, we go back to hemolytic anemia, which can be caused due to excessive destruction of red blood cells. I said we can have infections like malaria, we can have sickle cell anemia, and then we can have some blood transfusion incompatibility can cause hemolytic anemia. And then we can also have some drugs, toxic drugs and poisons like snake venom. Yes, it can lead to hemolytic anemia. Then in aplastic anemia, we have variety of diseases such as leukemia. Pre-leukemia conditions can cause anemia by affecting blood production in the bone marrow. So leukemia, it will attack the bone marrow. So when the bone marrow is affected, it will fail to produce the blood cells, thereby leading to anemia. Then thereby leading to anemia. We also have other conditions like cancer disorders. They can also affect the bone marrow, leading to anemia. Yes, so we also have some drugs. Yes, some drugs can also, yes, some drugs like chloramphenicol, yes, can lead to anemia. So can depress the bone marrow, and when the bone marrow is depressed, it will fail to function well, or it will fail to do its normal production of the red blood cells. So avoid taking unprescribed drugs. Just because someone told you to say, okay, try to take chloramphenicol, you don't know the side effects of chloramphenicol, and you don't know what chloramphenicol can do to your body. Then we also have life-threatening anemia caused by diseases in the bone marrow. Ability to reduce three types of blood cells, which is the red blood cell, the white blood cells, and the platelets. So I said those are some of the drugs. If you take some drugs, they are going to affect the blood cells. Then the cause of this aplastic anemia, mostly it's unknown. So let's avoid to take drugs, and then let's prevent some conditions like cancer, some conditions like leukemia. Then we have another type of anemia. We say the blood forming element deficiency anemia. This is a short element like iron, vitamin B12, folic acid in the body. The bone marrow needs all these, the folic acid, the iron, the vitamin B12 to form all the three bloods that I mentioned, the red blood cells, the white blood cells, and the platelets. So if you're not taking enough of these elements, you can end up having anemia. So having said that, let's talk about the predisposing factors. So predisposing factors It can be due to dietary deficiency. So if you're not taking the vitamins, iron, vitamin B12, folic acid, you can have anemia. If malabsorption, so if you have conditions that cause like colic disease, you can have anemia. We have inherited disorders like sickle cell. If you've inherited sickle cell, which leads to excessive destruction of red blood cells, you are predisposed to have anemia. We have autoimmune disorders like hemolytic anemia, where the immune cells attacks the red blood cells and it decreases their lifespan, because the red blood cells are produced at the same time they are distracted. So the normal lifespan of the red blood cells is 120 days. So after 120 days, they have to be destroyed and others have to be produced. So autoimmune disorders, they affect the lifespan of the red blood cells. And then I said of certain drugs, yes, so certain drugs can cause anemia. And then we have alcohol, antibiotics, anti-inflammatory drugs, anticoagulant medication can predispose you to have anemia. Then we have infections, like I said, like malaria, septicemia. They reduce the lifespan of the red blood cells, thereby predisposing you to anemia. Then we have periods of rapid growth or high energy requirements, such as puberty or pregnancy. So period of rapid growth, like someone has just turned into puberty, you are predisposed to have anemia because of the menstrual cycle. And then even others who are pregnant, we do the pathophysiology of pregnancy, where you have to split your blood to share with the fetus. Then you are predisposed to have anemia. Then we have blood loss, which is surgery, trauma, cancer, peptic ulcer, heavy menstruation. All those are predisposed to have anemia. And then we have chronic diseases like rheumatoid arthritis. Yes, we have tuberculosis. You are predisposed to have anemia. We have hormonal disorders such as hypothyroidism. Those people with hypothyroidism, they are predisposed to have anemia. And then we have bone marrow disorders like cancer, infection, and certain medication. They are also predisposed to have anemia. So now, let's talk about the pathophysiology of anemia. What really happens in someone who we say they have anemia, or what the body undergoes for it to come out as anemia. So I'm going to read through the pathophysiology. Take your pen. If you're a student, take your pen and your paper and write something that you hear, which is important, that will make you easy to remember. So I start. The red blood cells are produced of the same time where they are distracted. This ensures that the level remains within the normal. The average lifespan of the erythrocytes is 120, after which they are being destroyed. When the rate of production is exceeded by the rate of distraction, a deficient result giving rise to anemia comes up. A low HB means the oxygen carrying capacity of blood. This low HB means there is reduced oxygen carrying capacity in the blood. This will lead to the use of compensatory mechanism to meet up the body demands of oxygen, includes tachycardia. So when there is low HB, low hemoglobin, meaning there is low oxygen carrying capacity. So if there is low oxygen carrying capacity, your body will produce or will come up with a compensatory for you to have more oxygens in your body. So there will be tachycardia in order to meet the body demand for oxygen. This leads to cardiomegaly due to hypertrophy of cardiac muscles, which will eventually make the heart less efficient, giving rise to volume of symptoms. So your body will say, okay, can you start breathing fast? So there will be tachycardia. Tachycardia will lead to cardiomegaly. Cardiomegaly will lead to, due to hypertrophy of cardiac muscles, which will eventually lead to less efficiency, giving rise to a lot of symptoms. So having said that, let's do the signs and symptoms of anemia. So we'll have pallor due to low HB, we'll have heart palpitation due to tachycardia and myocardial hypoxia, we'll have dizziness due to cerebral hypoxia, we'll have easy fatigability. Yes, fatigability due to tissue hypoxia. Then we can have dyspnea due to myocardial pulmonary involvement. We can have fainting spells. Yes, some people will faint due to cerebral hypoxia. Then we can have headache due to cerebral hypoxia. We can have feeble pulse. Yes, feeble rapid pulse due to reduced blood volume and due to hypoxia. So hypoxia will be the main play in here. So we have bleeding tendencies due to lack of clotting factors. We can have cyanosis due to tissue hypoxia. Then we can have difficulty to concentrate due to cerebral hypoxia. Then we can have redness or cracked tongue. Yeah, so your tongue will appear red or cracked. Yeah, then we can have strange food craving due to the deficiency of some vitamins. So you can be craving to eat soil because you're lacking iron. Yeah, so those are the signs and symptoms of anemia. Then let's do the diagnostics. So diagnostic tests or the diagnosis, we can do medical history of any chronic disease. So you ask the patient of any chronic disease, regular medication. So which medication are you on? Are you taking any medication? So you take history for that. And then you, on physical examination, you can check for pallor. We can check for pallor. Then on cyanosis. Then on blood tests, we can do the full blood counts. We can do blood iron levels. Then we can also do gastroscopy or colonoscopy to rule out any cancer. Yes, any ulcers or cancers. Then we can do bone marrow biopsy. We can do bone marrow biopsy to rule out the bone marrow aplasia. Then we can do fecal cults to rule out chronic blood loss. Then after we've done the investigation or the diagnosis, we can do the treatment. So treatment, we are going to give folic acid. Yes, we can give folic acid, which is 5 to 10 milligram OD for 14 days. We can give ferrous sulfate, which is 200 milligram for 14 days, BD. Then we can give iron injections if the patient is very low in iron, e.g. Interferon, I don't know how to pronounce this word, 2 mils BD for 5 days. Then we can give vitamin B12, yes. Then we can do blood transfusion, yes. If the HB is very low, we can do blood transfusion. We can give oxygen therapy oxygen therapy if it is required to compensate for low hemoglobin, which is the oxygen carrying capacity. Then we can do surgery to prevent abnormal bleeding, such as heavy menstruation. So if this person is having heavy menstruation due to some other conditions, we can do surgery, yes. Then we can also give painkillers if this patient has headache. Yes, in severe headache, we can give painkillers. We can give also antibiotics if the anemia is due to the infections. So those are some of the medication we can give. Then we talk about complications. So we can have cardiomegaly. We can have heart failure, we can have renal failure. Then we can have hepatomegaly. So we can have cardiomegaly, hepatomegaly, renal failure, then heart failure. Prevention, so you have to take food diet. So make sure in your food you have iron, vitamin B12, then we have folic acid. So take precaution for your diet. Then we can have We can also prevent intestinal disorders. You can also have iron and folic supplements during pregnancy. So if you are pregnant, make sure you go for antenatal and they put you on the folic and ferrous sulfate supplements, please. And then you can also prompt an adequate management of infections like malaria. So if you have malaria, make sure you go to the hospital. You are given treatment to prevent the excessive destruction of the red blood cells. Then avoid unprescribed drugs. Like I said, drugs such as chloramphenicol is not good for you if you take them in a long period. Then regular deworming to prevent worm manifestation like hookworm, such as hookworm. So we know hookworm, the pathophysiology of hookworm. So please make sure you do deworming. Yes, and then child spacing to prevent anemia, because if you are frequenting going into labor, losing a lot of blood, you can end up having anemia. Then I've talked about antenatal. Make sure you go for antenatal to prevent anemia and to prevent hemorrhage. So it can be pre-hemorrhage or postpartum hemorrhage. So your nursing care or your nursing management, you aim to eliminate the causative organism, increase the oxygen carrying capacity of the blood, then reduce the demand for oxygen, then alleviate discomfort, and then prevent complications. You can also prevent acquisition of infections. So you prevent infection. Then the general nursing management, we do the acron of eprophenema. So if for environment, make sure you nurse this patient in a very clean and quiet environment. You're going to nurse this patient in a general ward. Yes, unless if the patient needs oxygen, that's why we're going to nurse the patient on the nurse's bay, or on the acute bay for ease observation of the patient. Then I beg your pardon. Then we position, P for position, we're going to position this patient in a very comfortable position. Then rest, R for rest, we're going to ensure rest, so the environment should be quiet for the patient to rest, and then we are going to restrict visitors to allow the patient to rest. Observations, we are going to do vital signs which will act as the baseline data and to detect any abnormalities from the normal. Then another P is psychological, so we are going to give psychological care to this patient. You're going to explain the disease process, you're going to allay anxiety to the patient to gain cooperation. Yes. So, and then we have H for hygiene. You're going to make sure that where the patient is bathed, if there is need to bath, air wash, mouth wash, nail care, we're going to do all those for the patient. Then exercises, another is for the exercises. We're going to allow the patients to do exercises if the condition is not very critical. Yes, so the patient, and if the patient is admitted in the ward, we allow ambulation just to exercise to promote blood circulation. Yes, and then for nutritionists, and for nutrition, so we will call the nutritionist. We will explain the type of diet the patient needs to take. Yeah, the nutritionist to help to explain the type of diets the patient should take. Then another E is for elimination. We are going to monitor the input and output of fluid for this patient. M is for medication. So we are going to give all prescribed medication to the patient. A is for advice. So on discharge, we are going to advise the patient. We are going to tell the patient the do's and the don'ts. Yes, so we are going to advise the patient the importance of the review days, the importance of taking medication. All those will be explained to the patients on discharge. So that's all about anemia. Hope you've learned something. Hope you've enjoyed this presentation. So from me to you, it's bye and God bless you. Please don't forget to subscribe. Don't forget to turn on notification bells. Don't forget to smash the like button. And don't forget to drop comments. So bye and God bless you.